I'm Dr. Deepthi Kancharla, consultant surgical oncologist. Today we are going to talk about mammogram. So what is mammogram? So mammogram is nothing but an X-ray of your breast in a simple language. So they'll use low-dose X-rays to take a picture of your breast. If there is any abnormality that is present, can be diagnosed and treated accordingly. Not everyone with breast cancer will present with a lump, or we can diagnose the lump only when it attains to a certain significant size, because the female breasts are so big that even the small lumps cannot be diagnosed so easily. We cannot feel it with our hand. So mammograms will diagnose those lumps which are not felt by our hand very early. It is usually said a mammogram detects a lump 3 years before it is felt by the hand. So we can diagnose if any lumps are there very early before they are felt by hand. Accordingly, we can treat so that we can detect in an early stage, we can treat it in an early stage so that we can live for more years. Compared to that, compared if we don't get mammograms done regularly as said by the doctor. Mammograms are not painful as such, but there will be little discomfort because during mammogram, your breast will be compressed in between the two plastic plates. So because of that pressure, you will feel little discomfort. There are certain situations where your breasts are more sensitive so that you will feel little more discomfort, like if you are in your periods or just due for your periods, the breast will be more sensitive. So it's always better to schedule your test a week before or after the period. And next is caffeine, that is coffee. So that also makes your breast more sensitive. So it's always better to withhold coffee a day or a couple of days before your test. Yes, otherwise it's not so painful. Generally, for a healthy female, the mammograms are recommended starting from the age of 40 years. So they have to start getting that mammogram at the age of 40, and they have to get them annually, like for every year. So but there are certain category of women who are called high-risk women, like people who have family history of breast cancer, that is mother or sister or grandmothers who had breast cancer or ovarian cancers. So they are high-risk women, and women who already had breast cancer on one side, or women who had exposed to radiation before the age of 30. These are all said to be high-risk women. They have to start their mammograms a little bit early than the normal people, that is around the age of 30. So they should start their screening at the age of 30. So ideally speaking, there are no risks with mammogram compared to the benefits it is having. But theoretically, you are exposed to some amount of radiation, so which is said to have some risk of getting cancer again, but that is very theoretical. So it is not practical at all. So when you compare the advantage you are getting with the mammogram, so there is a very little insignificant risk. So it is always safe to get a mammogram done. There are certain conditions where mammogram cannot pick up the lumps in the breast, like very dense breast. Like in a younger age, the breast will be very dense, that you will be having more fibrous and glandular tissue because of the milk production. So the lumps and this tissue will look the same. So then it is difficult for mammo to pick a lump if at all is present. So we can use either MRI, and there is a new modality called molecular breast imaging. So but these are all just adjuncts, like we have to use them along with mammogram, but they are never an alternative to mammo. So yes, there are no alternative, but there are extra tests which can be added to mammo to increase the sensitivity, that is to detect the cancer.